Hello YouTube, this is Dr. Mark Haverkorn of River City Oral and Maxillofacial Surgery in San Antonio, Texas. Today I have a video of me removing what is probably an epidermoid cyst of the left cheek. The pathology is pending and we'll have it in a few days to know for sure. If you watch very many of these kind of videos, you're probably familiar with an epidermoid cyst already. They're common on the face and trunk and are filled with dead skin cells and keratin. To keep this from coming back, we need to try and get out the entire lining. It can be a nice challenge to try and take these things out intact without popping them, but that's going to require a larger cut in the skin. You can do it with a smaller, more cosmetic incision if you just go ahead and pop it and remove the line. We want the scar to parallel one of the resting skin tension lines, which means the scar should be perpendicular to the underlying muscles, which means that the underlying muscles are helping to pull the skin closed instead of pulling it apart and making the scar wider. Okay, that actually hit my glasses, which is why we wear glasses, gowns, and gloves in the first place. Okay, I'm just going to push here a little bit. Okay. Now, all you're going to feel from here is just pushing, pulling, tugging. Okay. In order to numb this area of the face, I used a left mental nerve block, a left infraorbital nerve block, and a left long buccal nerve block. I gave that time to work, then I went back and infiltrated right around the cyst. There was a great article written about 30 years ago called How to Block and Tackle the Face. I read that at the beginning of my residency, and it really just had some great pointers on how to numb somebody up. Okay, so here I'm cutting out an ellipse of skin over the top of the cyst. The patient's going to end up having extra skin anyway, so cutting out this ellipse isn't going to change anything, and it gives me a little better access. All right, pay attention guys, it's about to get real good. This is the part that you came to see. I'm just pushing on it. I'm just deflating it. And here it is again in slow-mo. Okay, so here I'm just dissecting out the cystic lining. I'm going to use those Adsons there to pick up the cyst lining and then the scissors to dissect it out. Now those Adsons are kind of short pickups, short tweezers, and I really prefer a longer one, either a Gerald or a Cushing with teeth. So here in just a second you'll see me switch there to a Gerald with teeth. So I know that lighting has been an issue in these videos. I always wear a surgical headlight when I operate, whether it's in my office or in the operating room. I got used to it in training and I really like it, but it obviously messes up the white balance on the camera. I'm going to read more about how to fix that, and if you guys keep watching, I'm going to get some better equipment. I'm already looking at a GoPro that mounts into the headlight. I guess I could leave the headlight off and use the GoPro to help with the light. But anyway, just bear with me on this and I'll get it worked out. Okay, the lining's out, so we're going to rinse out the hole with some sterile saline and get ready to close it. I'm going to close the wound in 2 layers, with the deep layer being this 3/0 vicryl suture on an RB1 tapered needle. You want all the pressure of the wound closure to be on the deeper sutures, not on the skin. So I use vicryl because it lasts longer while the wound is healing and maturing. I've opened up wounds, months or even a year after the fact and still seen vicryl on occasion, but generally it lasts a couple of months. Anyway, we're going to bury the knot, which means it's on the deepest part of the wound instead of closer to the surface. It's really a lot easier to figure out if you just Google buried suture knots and look at the diagrams. And then I like using a tapered needle because it does less damage to the tissue. In dental school, we were always taught about using cutting needles and taught to use cutting needles in the mouth. But really, a tapered needle is great for deep sutures like this. It's great for inside the mouth. And of course, they're used for all sorts of other surgeries, whether that's abdominal surgery or extremity surgery. Tapered needles are just used more commonly because they make smaller holes in the tissue and don't damage the tissue, which is really important when you need a watertight closure or you're doing some delicate work. Notice with these buried stitches that I cut the tails of the stitch as close as I can to the knot. A well-tied knot's not going to come undone just because you cut it short, and by removing those tails, there's less chance of those sticking through the wound, becoming infected, or just being a nuisance. I like it. I'm good with that. Okay. I'm going to get some skin suture and then we're done. You want it to be a little bit raised because the scars always retract. If it starts flat, you're going to end up with a crater. So I don't know if you could hear what I was saying, but you want the deep sutures to create what we call an everted wound, which means you want it to stick up a little bit to make a ridge above the surrounding tissue. Because when wounds mature, when scars mature, they contract down. So if the original wound closure is flat, over time, you're going to end up with a sunken scar that's much more visible. One of the things that makes scars visible is the way that they reflect light. So if they create shadows or highlights where there wouldn't normally be one, they're more obvious. These nylon sutures feel like fishing lines, so if you don't leave a little bit of tail on the end of the knot, they will sort of pop themselves untied. Also, a tail is real handy when you're trying to remove the stitch. You can actually grab onto something. It's all closed up. I'm just cleaning it off a little bit. Okay, that's what you want. You want to see that, just that nice ridge. Okay, that's it. Thanks. Here's a shot of the cyst lining. I stretched it out and rinsed it out so you could get a good view. Thank you guys for watching. Please like, subscribe, share, and give us a call. Finally, I would like to thank this patient and all the patients that have allowed us to film, and I would like to thank my staff for helping out with the film.